Welcome to Focus Dental Imaging. This tutorial will explain a little bit in a quick reference type of way how to use your data set within the ICAT viewer software. So let's take a look real quick. We have your name, we have the CT data, and here's the main windows. This is the main preview screen right here. That's where we're at right now. I don't do really any work in this screen set, but know that the data is here. So one thing I want to talk to you about is how these screens are set up. So there's 4 different types of screens, and they're all traditional type screens. We're only going to talk about the implant screen here because that's usually what people are interested in doing. Here, if you look at now the screen, you have all these slice views available to you. This blue line here represents this screen here cutting across the jaw. This middle blue line here in the middle represents the slice in this window here with the blue collar around inside that one. That's the middle one here, and the middle line here is this slice view here. These auxiliary slices are the slices distance 2.5 millimeters away from each other, and you can see it says, or 2 millimeters away from each other, sorry, 0, 2 millimeter, 2 millimeter away from our middle line here. So if we want to bring it down to a millimeter, you can grab this little icon here and move it forward. So we go to 1 millimeter. I typically like to see a 0.5 millimeter. So now each slice view is about a 0.5 millimeter, according to when we move the middle bar here. And you can see how it just changes. So that's one thing. The second thing is if we want to look at the jaw a little better, we can look like this. The one issue is how come my upper jaw doesn't match the lower? It's not very clear. The data is not there. No, the data is there. It's just that this panoramic view is based on our axial slice view here. So if I go all the way up to the upper jaw, you'll see that our slice view position is totally out of the arch of the upper one. So you have to now reshape this arch view so that we know that we're going to get a good view of the arch that we're looking for. I'm only going to do half the arch here so you can see the difference. This is the right side of the patient. This is now the left side. There's a little R that indicates the right side. Now, see how much more clear that this section is now? Because I made it so that it is now in this viewer slice here. And if we want to do a little better towards the front, maybe we bring that a little more forward. We bring those dots. So, and now you'll see our slice view getting better here as I go forward here and make the appropriate thing. One last tip on this section that we're talking about is it's very important. Each section, each window section here, or in one of these is invisibly sliced into 3 sections. So this far section over here, or the right side of the patient, or your left side per window, whichever way you want to think about it, has an icon like this. It's this little crosshair thing. That allows you to grab on it and move it any which way you want to move it around the screen. So that's what that means. When you're all the way to the right or the patient's left, it's now a little magnifying glass with a little Z. That means we can zoom in or out. So if you grab your left click and you go in or out, you can move it in or out. Now, if you want to go down the middle, there's a middle section about this big. It has this like slope icon with a W. And what that basically is your contrast. So if I want to go higher contrast or less, you'll go dark or you go lighter, whichever one you like, to alter that right away. And that works for all windows. So I can do it here. Every once in a while, the software defaults to something like this. and then people don't know that they have data. They think it's all gone. All you have to do is just bring up the contrast. So that's pretty simple. It's pretty quick. You can read the tutorial, like we said, up here in the help menu. Quick reference guide will basically show you everything you want to know about what I just explained and even more. And it's a simple PDF file and it explains each of those windows. But that'll get you started. Thanks.